Polycystic ovary syndrome. The best treatment options. Polycystic ovary syndrome is a common endocrine system disorder among women of reproductive age. Women with PCOS may have enlarged ovaries that contain small collections of fluid, called follicles, located in each ovary as seen during an ultrasound exam. Infrequent or prolonged menstrual periods, excess hair growth, acne, and obesity can all occur in women with polycystic ovary syndrome. In adolescence, infrequent or absent menstruation may raise suspicion for the condition. The exact cause of polycystic ovary syndrome is unknown. Early diagnosis and treatment along with weight loss may reduce the risk of long-term complications, such as type 2 diabetes and heart disease. Symptoms. Polycystic ovary syndrome signs and symptoms often begin soon after a woman first begins having periods. In some cases, PCOS develops later during the reproductive years, for instance, in response to substantial weight gain. PCOS has many signs, things you or your doctor can see or measure, and symptoms, things that you notice or feel. All of these can worsen with obesity. Every woman with PCOS may be affected a little differently. To be diagnosed with the condition, your doctor looks for at least two of the following. Irregular periods. This is the most common characteristic. Examples include menstrual intervals longer than 35 days, fewer than 8 menstrual cycles a year, failure to menstruate for 4 months or longer, and prolonged periods that may be scant or heavy. Excess androgen. Elevated levels of male hormones may result in physical signs, such as excess facial and body hair, adult acne or severe adolescent acne, and male pattern baldness. Polycystic ovaries. Polycystic ovaries become enlarged and contain numerous small fluid-filled sacs which surround the eggs. See your doctor if you have concerns about your menstrual periods, if you're experiencing infertility or if you have signs of androgen excess such as acne and male pattern hair growth. Causes. Doctors don't know what causes polycystic ovary syndrome, but these factors may play a role. Excess insulin. Insulin is the hormone produced in the pancreas that allows cells to use sugar, your body's primary energy supply. If you have insulin resistance, your ability to use insulin effectively is impaired, and your pancreas has to secrete more insulin to make glucose available to cells. Excess insulin might also affect the ovaries by increasing androgen production, which may interfere with the ovary's ability to ovulate. Low-grade inflammation. Your body's white blood cells produce substances to fight infection in a response called inflammation. Research has shown that women with PCOS have low-grade inflammation and that this type of low-grade inflammation stimulates polycystic ovaries to produce androgens. Heredity. If your mother or sister has PCOS, you might have a greater chance of having it, too. Researchers also are looking into the possibility that certain genes are linked to PCOS. Complications. Having polycystic ovary syndrome may make the following conditions more likely, especially if obesity also is a factor. Type 2 diabetes. High blood pressure. Cholesterol and lipid abnormalities, such as elevated triglycerides or low high-density lipoprotein cholesterol, the good cholesterol. Metabolic syndrome, a cluster of signs and symptoms that indicate a significantly increased risk of cardiovascular disease. Non-alcoholic steatohepatitis, a severe liver inflammation caused by fat accumulation in the liver. Infertility. Sleep apnea. Depression and anxiety. Abnormal uterine bleeding. Cancer of the uterine lining, caused by exposure to continuous high levels of estrogen. Gestational diabetes or pregnancy-induced high blood pressure. Tests and diagnosis. There's no specific test to definitively diagnose polycystic ovary syndrome. The diagnosis is one of exclusion, which means your doctor considers all of your signs and symptoms and then rules out other possible disorders. During this process, you and your doctor will discuss your medical history, including your menstrual periods, weight changes, and other symptoms. Your doctor may also perform certain tests and exams. Physical exam. During your physical exam, your doctor will note several key pieces of information, including your height, weight, and blood pressure. Pelvic exam. During a pelvic exam, your doctor visually and manually inspects your reproductive organs for signs of masses, growths, or other abnormalities. Blood tests. Your blood may be drawn to measure the levels of several hormones to exclude possible causes of menstrual abnormalities or androgen excess that mimic PCOS. Additional blood testing may include fasting cholesterol and triglyceride levels and a glucose tolerance test, in which glucose levels are measured while fasting and after drinking a glucose-containing beverage. Ultrasound. An ultrasound exam can show the appearance of your ovaries and the thickness of the lining of your uterus. During the test, you lie on a bed or examining table while a wand-like device is placed in your vagina. The transducer emits inaudible sound waves that are translated into images on a computer screen. Treatments. Polycystic ovary syndrome treatment generally focuses on management of your individual main concerns, such as infertility, hirsutism, acne, or obesity. Lifestyle changes. As a first step, your doctor may recommend weight loss through a low-calorie diet combined with moderate exercise activities. Even a modest reduction in your weight, for instance, losing 5% of your body weight, might improve your condition. Lifestyle and home remedies. Keep your weight in check. Obesity makes insulin resistance worse. Weight loss can reduce both insulin and androgen levels and may restore ovulation. No single specific dietary approach is best, but losing weight by reducing how many calories you consume each day may help with polycystic ovary syndrome, especially if you're overweight or obese. Use smaller plates, reduce portion sizes, and resist the urge for seconds to help with weight loss. Ask your doctor to recommend a weight control program, and meet regularly with a dietitian for help in reaching weight loss goals. Consider dietary changes. Low-fat, high-carbohydrate diets may increase insulin levels, so you may want to consider a low-carbohydrate diet if you have PCOS, and if your doctor recommends it. Don't severely restrict carbohydrates, instead, choose complex carbohydrates, which are high in fiber. The more fiber in a food, the more slowly it's digested and the more slowly your blood sugar levels rise. High-fiber carbohydrates include whole grain breads and cereals, whole wheat pasta, bulgur wheat, barley, brown rice, and beans. Limit less healthy, simple carbohydrates such as soda, excess fruit juice, cake, candy, ice cream, pies, cookies, and donuts. Be active. Exercise helps lower blood sugar levels. If you have PCOS, increasing your daily activity and participating in a regular exercise program may treat or even prevent insulin resistance and help you keep your weight under control.